Hi everybody, I'm here with our very intelligent medical student Riley today, and we're going to talk about GLP-1 agonists, and we're also going to talk about how they are related to depression. So, Riley, take it away!
Yeah, so what inspired this conversation is we saw a post on social media from a psychiatrist who was talking about there being a potential link between GLP-1 agonists, which you might know as drugs like Ozempic, and depression or even suicidality.
Yeah, and he's a controversial person, so we're not going to throw any names.
Yeah.
So
we did some investigating into this, and although we couldn't find the actual article, which is interesting.
Does it exist?
Right. We did see some people commenting that the study didn't find a direct correlation between these drugs and depression or suicide, but that it just might increase depressive or suicidal ideation, but that actual suicide attempts and completion decreased in the group that was looked at.
And if anybody knows where to find this study, please let us know. Yeah, we're looking for it.
Yeah. But on the other hand, there are quite a number of people who have reported that these medications have improved their mental health. And I think there are a number of reasons why this could be. One might be as simple as these medications are helping people achieve goals that they've been struggling with for a long amount of time usually, and just being able to see change in your health is a positive thing for people's mental health. GLP-1s are active in the central nervous system as well as in our intestines, and they work in a variety of ways. They obviously increase insulin sensitivity, and so that's why it's helpful for people with diabetes, but they also have an impact on neurotransmission and may even decrease neuroinflammation in our brains. And it has been hypothesized that one of the mechanisms of depression could be through neuroinflammation. So there might be a potential benefit to taking these drugs in people with depression to help decrease the neuroinflammation in their brains.
Yeah, so whenever you have inflammation in the brain or spinal cord, that's called neuroinflammation, and you have too much of it, that can be associated with cognitive difficulties and also depression. So if you're able to alleviate that, that could be one mechanism that's protective in that regard.
There also could be a link between mental health and Ozempic or these GLP-1 agonists just through the brain-gut connection. And if you're curious...
We have a video about that.
Yeah.
Right here.
Please see that video if you want to learn more. But basically the idea is that through changing the makeup of your gut, it might have an impact on your brain as well in a positive way. Another interesting thing that we've seen is that GLP-1 agonists have been shown to delay gastric emptying. So that's actually something beneficial in people that are trying to lose weight with these medications. But on the other hand, it's a curious question of whether that might affect the absorption of certain oral medications that we take. So I think more research needs to be done. We're not exactly sure if the slowing of absorption is enough to actually cause a difference, but it could be worth looking into. And then another good point that some of these articles have made is that a potential reason why people might struggle a little bit more with their mental health when they start these medications is because for a lot of people, whether they know it or not, food has been a coping mechanism for most of their life. And that influences the reward pathways in our brain. So when you start taking a new medication that's completely changing the way our brain perceives reward, that might be difficult, especially if that's your main coping mechanism. So
it's important to talk to your mental health providers if you are taking it and make sure that you have alternative coping mechanisms.
Absolutely.
And talk about the potential interference with any of your medications, whether psychiatric medications or other types of medications.
Yep. Anything else?
Oh, no, it could maybe improve mental health because if you're struggling because of your weight, or if it's causing you immobility, or if it's causing you physical ailments or issues in social aspects, or any issues that you would have from being overweight, alleviating those could potentially help your mental health if you are feeling more confident, or if you're feeling healthier, or if you're finally able to get out and move. Like, that could certainly be a benefit.
Absolutely.
Thank you, everybody.
Thank you.